Hi viewers, I'm Dr. Shashant. I'm a clinical andrologist at Ferty9 Hospital, Secunderabad. Today, I am going to give you some tips to manage if you have the COVID-19 infection. What can you do next? So the first thing is, most of the times in 80% of the infection, the symptoms will be mild. Generally, 80 to 90% of the times, you will be having symptoms such as fever, dry cough, diarrhea, anosmia, which is basically lack or absence of smell or taste. So, and you can have weakness, giddiness, and sometimes shortness or difficulty in breathing. So, if you are experiencing any of these symptoms, make sure that you get yourself tested by doing a test called RT-PCR for COVID antigen. COVID-19 is a disease caused by a virus which is SARS-CoV-2. So this virus is having a protein, spike protein, which infects the cells. So virus is basically a small tiny microorganism consisting of a RNA or a DNA code surrounded by a protein which infects a cell and destroys it. That is why you get ill. You can get ill most of the times. It is minor and sometimes it is severe. So in mild cases, you can manage this situation at home itself, because already the hospitals are under severe lack of beds and lack of oxygen. So therefore, they will usually be advising you to take care of the illness at home as far as possible, as long as it is in the safety limits. So how should you tackle if you have this COVID-19 infection? First thing is, you need to get a certain equipment. First thing you need to purchase is a pulse oximeter. This is a simple digital method which is having a probe. You can just keep it on your finger and it will give you your heart rate and the percentage of oxygen in your blood. So using this, you can track that your oxygen levels, ideally they should be above 95%. If they are below 95%, then it is advisable to visit a doctor, because below 95% may require sometimes a hospital admission. Second thing is, the doctor may or may not advise you a high resolution CT scan, because RT-PCR test is usually accurate just 90% of the times. If the test is negative, it may still be a possibility that you can have the COVID infection. And high resolution CT scan, it shows some characteristic findings in a COVID-19 infection, and the radiologist, doctor who will see your CT scan will be grading it from a severity score of 1 to 25. So it is a good idea to get tested, particularly for HRCT if you are having any shortness of breath. So another red flag symptom is if you are having repeated fever spikes, fever episodes of more than 101 Fahrenheit for more than 3 times, which is not responding to simple tablets that you take for fever, for example paracetamol, which is crocin. Third important thing is, please practice social distancing measures whenever you're feeling ill. Don't leave the house as far as possible. Keep a doctor's phone number or a contact nearby for asking or taking any suggestions or help regarding your illnesses. Don't try to manage it all by yourself. Ensure that if the illness worsens, you know which hospital to visit. So please keep these things planned beforehand itself. Ensure that you do not share your utensils or your bed sheet, and you do not come within 1 meter proximity of your family members, because they can also be susceptible, and some patients may have some comorbidities such as high body weight, high body mass index, obese patients, or those who are having some immunocompromised conditions chronic medical illnesses, those who have, for example, tuberculosis or bronchial asthma or diabetes, so they are having higher tendency for a exaggerated illness in COVID-19 infection. So the next clarification is, if most of the times in the mild illness, you can improve your disease course by taking some healthy diet along with vitamin supplementations, vitamins A, C, D and E. These are the 4 vitamins that you can purchase from any pharmacy. You will be getting some tablets. If the doctor has prescribed, you can take it on a daily basis. Ensure that you are plenty hydrated. Please drink sufficient of liquids, and you should have a physical activity of at least 15 minutes every day, 3 times for 15 minutes at least, so that the risk of blood clotting is decreased. Then after taking all of these measures, if you are able to overcome the illness, please ensure that you help your other fellows and friends, and ensure that your mental health is very much looked after, because a lot of people they can cause panic and anxiety by spreading misinformation. So please check your news from authentic sources only. With regards to COVID-19 vaccination, I am going to give you a few tips. So as of the current day data, COVID-19 vaccine is recommended for the patients who are planning for pregnancy, because the benefits outweigh the risks. Wherever the patients, when they have done the studies and the research, they have found that the patients who had received the vaccine, those that the couples that were planning for pregnancy, they had a normal natural conception as well, and their entire pregnancy course was also normal. So it is also advisable to take the vaccine in pregnancy, whether you are in the early or in the late trimester. Preferably in the early trimester, if you take the vaccine, you can avoid the complications of COVID infection if you were to get it in your later half of pregnancy. Normally, in most of the situations, if you get a COVID infection in the early, that is in the first half of your pregnancy, you are likely to have mild symptoms. And usually pregnant patients, they are actually they are not really more susceptible, but their immune response is altered against the virus. Their defenses against the virus may be different. In the later half of the pregnancy, what can happen is the patient, the pregnant lady, she can have a severe disease. She can have extensive lung involvement, resulting in ICU admission. More number of pregnant patients who are in the later half of pregnancy, they have been shown to have hospitalization and ICU admissions. And there is a 3 times increased risk of premature delivery, that is preterm labor, resulting in the baby being admitted to the NICU. So to avoid these risks, it is advisable for patients who are planning pregnancy or patients who are early in their pregnancy to take the COVID vaccine. The COVID vaccine are also safe for women who are breastfeeding. The vaccine generates some amount of IgG and IgA antibodies, but very little of Ig antibodies. So the Ig antibodies are capable of passing from the breast milk to the baby, but the vaccine does not generate sufficient quantity of IgA. What it helps is increasing the IgG antibodies, and IgG antibodies will protect the mother, and it is also safe for the breastfeeding mothers. If you are to contract an actual COVID infection at the time that you are breastfeeding your baby, you have to take all the precautions such as wearing masks, sanitizing your hands, and at the time when you are not breastfeeding, ensure that the baby is at a safe distance away. Importantly, the actual COVID infection will raise the levels of IgA as well. So you can pass on these antibodies to your baby. So it will offer some amount of protection against the COVID virus to your newborn baby as well. So in this pandemic, in the second wave of the COVID infection, I hope that all of y'all practice the social distancing measures. Ensure that you sanitize or wash your hands with soap. Ensure that you're not sharing utensils with your susceptible family members, and ensure that you're wearing a good tight fitting mask. The seal of the mask should be correct. Preferably now they are advising to wear a double mask because it offers a better protection. So take all of these precautionary measures, and I hope that you stay safe and stay healthy. If you are not feeling well, it is advisable to stay at home. And if you have any comments, you can please type it in the comment section below. Thank you.